This is the Oregon Health Authority Nurse Staffing Survey and Process Tools webinar. This webinar was originally presented on January 18, 2017. Due to some audio difficulties with that presentation, this presentation has actually been re-recorded so it could be archived on the nurse staffing website. The questions that were submitted during that original January presentation will be incorporated into this recorded webinar. Before we get into the tools themselves, we'll talk a little bit about the differences and similarities in standard surveys and nurse staffing complaint investigations. Both standard nurse staffing surveys and complaint investigations have similar report and plan of correction timelines. For both surveys and complaint investigations, 30 business days after the exit conference and the closing of the survey or complaint investigation, the surveyor and the OHA will provide to the hospital and to the hospital nurse staffing committee co-chairs the report detailing findings. The hospital then has 30 days to submit and it's 30 business days to submit a plan of correction. Both surveys and complaint investigations have similar entrance activities, with surveyors presenting to the hospital administration and conducting an entrance conference and providing the hospital with a needs list, which we'll talk about in more detail later. At the end of the on-site portion of a survey or complaint investigation, the surveyors will have an exit conference where they discuss with the hospital administration some preliminary findings. One of the questions we received was why these conferences are held only with hospital administration and not with the hospital nurse staffing committee or the labor side of nurse staffing. The Oregon Health Authority licenses the hospital, and therefore it's the hospital that's responsible for communicating and responding to the Oregon Health Authority in both surveys and complaint investigations. And so that's why it's the hospital administration in these entrance and exit conferences. And then the last similarity is that both surveys and complaint investigations will have their results, so their report and any plan of correction, posted online, and the OHA maintains both of these documents in our paper files as well. There are some characteristics that are unique to surveys. For example, each hospital will be surveyed once during every 3-year cycle. Complaint investigations are the result of specific complaints, and so there's no timeline for how often those come into our office. In surveys, the hospital administration and the nurse staffing committee co-chairs receive advance notice of a survey that is sent out 3 business days prior to the survey. In addition, in a standard survey, the surveyors review relevant records using the survey tools we're going to look at today. They interview co-chairs, and they interview other staff and patients as needed. For complaint investigations, the OHA will conduct an on-site investigation within 60 days of receiving a nurse staffing complaint. By receiving, we mean that the surveyors are able to determine that there are nurse staffing issues raised in the complaint. So if a complaint is unclear, the surveyors will contact the complainant and ask for additional information to determine whether there are nurse staffing regulations at issue. Complaint investigations are unannounced, so neither the hospital nurse staffing committee or its co-chairs or the hospital administration receive notice of the complaint investigation in advance of the surveyors arriving on site. A complaint investigation includes a review of records and interviews of individuals as needed to determine compliance with the regulation that is the subject of the complaint. So the nurse staffing survey is a much broader look at all aspects of nurse staffing, whereas the complaint investigation focuses on the specific regulation that has been the subject of the complaint. And in complaint investigations, the surveyors will likely use some of the survey tools to facilitate their review of records, but they're not required to use any of them. You'll notice that there is no automatic interview of hospital nurse staffing committee co-chairs in complaint investigations. Co-chairs are only interviewed in complaint investigations if the surveyors determine that the co-chair is likely to have evidence related to the specific nurse staffing complaint that's being investigated. The survey process begins before the surveyors leave the Oregon Health Authority. They develop a detailed survey plan and they review information about the hospital where they'll be doing a survey. They review whether there are any current nurse staffing waivers at that hospital. They review the services provided by the hospital. They review licensure and ownership. They look at any prior surveys or complaints related to nurse staffing at the hospital. This includes prior investigation reports, prior survey reports, and prior plans of correction. They look at both the on-campus and off-campus locations where the hospital operates. And for a survey, they provide notice to the hospital and the hospital nurse staffing committee co-chairs 3 business days prior to the survey. On the first on-site day of the survey, the surveyors present themselves to the hospital administration and have an entrance conference. At the entrance conference, they explain the purpose and the scope of the survey. If it's a complaint investigation, they explain the scope of the complaint investigation. However, the complaint itself and the complainant's identity are confidential. They explain during the entrance conference the survey process, and they discuss logistics. Surveyors will need a workspace, access to photocopiers, and so they discuss all this at the entrance conference so that they are able to have their needs met during their time on site. In addition, they provide the hospital with a needs list that details documents that are to be provided to the surveyors. If you look on the handout that accompanies this presentation, you'll see the one that is titled as the Nurse Staffing Survey Needs List, and it says Slide 4 in the lower right-hand corner. This presentation, PowerPoint, includes the first of 7 pages in the sample needs list. Each needs list will be specifically tailored to the hospital, so it's possible that not all of these items will be on the needs list, or that there will be additional items that are not included in this needs list. But this gives you a general idea of the types of things that surveyors will be requesting when they arrive for a survey. And some of these items are likely to also be requested if they arrive for a complaint investigation. If you look through the sample needs list, you'll notice that it's actually broken down by when it would be provided to the surveyors. Some documents they would expect to receive within an hour of the end of the entrance conference, whereas other documents are within 4 hours, and they may be broken down. There are also documents within 2 hours of the end of the entrance conference. Depending on the complexity of the documents, the specificity of the documents, the surveyors will give the hospital more or less time to provide them. Certain documents, like the nurse staffing plan or the policy regarding mandatory overtime, are general sort of documents that should be fairly easy to provide, whereas other documents regarding specific schedules within a time frame, for example, the ED schedule for 2 weeks in January, may take longer to provide. And so the needs list reflects these timelines. Having completed the entrance activities, the surveyors will spend the next 1 to 5 days gathering information on site. And on site means both at on-campus and off-campus hospital locations. They will interview staff, patients, and during a survey, the Nurse Staffing Committee co-chairs. They will perform administrative document review of policies and procedures, contracts, personnel records, staffing records, and other records as needed. And during this time, they confer with one another and begin to make some preliminary findings regarding the information they have gathered. On the final day of survey, the surveyors will again meet with the hospital administration for an exit conference. The surveyors will share their preliminary findings and describe the next steps in the nurse staffing survey process. The survey closure date is frequently the same day as the exit conference, but it may be later if surveyors need to complete additional interviews or have requested that the hospital submit additional information to clarify outstanding questions. After the survey closes, as I said before, the surveyors have 30 business days to complete their written survey report. The survey report is issued to both the hospital administration and the Nurse Staffing Committee co-chairs. It is sent separately to these 3 distinct contact addresses. This is one reason why it's so important to keep the OHA up to date when your Nurse Staffing Committee co-chairs change. And there is a form on our website, healthoregon.org/nursestaffing, that hospitals can submit with contact information of new Nurse Staffing Committee co-chairs. In the report, the surveyors will document any deficiencies identified during the on-site audit or in complaint investigation. 30 business days after the report is issued, the hospital needs to submit a plan of corrections to the OHA. The plan of corrections documents the hospital's plan to correct each cited deficiency. The OHA must approve the plan of corrections or send it back with a request for additional discussion or development. Once the hospital has submitted a plan of corrections that is approved by the OHA, the hospital has 45 business days to implement the changes detailed in the plan of corrections. Within 60 business days after the plan of corrections is approved, the agency must reevaluate any deficiencies that were found in the original report. This can be a desk audit or another on-site survey, and the surveyors implement or assess the implementation of the hospital's plan of correction and the abatement of any cited deficiencies. So now we'll talk about the survey tools themselves. Surveys focus on compliance with nurse staffing laws and administrative rules, and specific topics covered in a standard survey are the hospital nurse staffing plans, both the implementation of the plan and the plan components, replacement staffing requirements, posting requirements, hospital nurse staffing committee requirements, and overtime limitations. A complaint investigation may focus on one or more of these topics and may use some of the same tools. The survey tools are a way to gather information on each topic and analyze that information. Some tools analyze information regarding more than one topic, whereas other tools are very specific and focus on just one narrow regulation. Data from the tools is used to complete the nurse staffing workbook that we'll look at the end of this presentation, and the workbook is what surveyors use to track information before they then can enter that into the agency report. The nurse staffing survey tools related to nurse staffing plans are separated into survey tools for implementation and survey tools for plan components. So the first of the tools that we'll look at is the time block selection tool. If you look at the handouts, you'll see that this is labeled as slide 11 in the lower right-hand corner. Because hospitals operate 24/7, there are a lot of blocks of time, and surveyors cannot look at every single minute or hour of a hospital's operations. So when they are doing a standard survey, they will select specific blocks of time to review the nurse staffing in a specific unit during that time. The time block selection tool allows them to select specific blocks of time and to indicate which units they're looking at and which dates, and then which block of time they're using. For each unit surveyed, they will generally look at 3 specific blocks of time, and they try to make sure that the survey sample includes 1 block from each of the categories. If a unit does not operate in all categories, then they can choose blocks of time from the categories when the unit does operate. If a unit operates sporadically in one category, then they will likely select a block of time during that sporadic category in order to make sure that the hospital is appropriately staffing during after-hours use of that unit. The nurse staffing data review takes the time block previously selected and allows the nurse staffing surveyors to actually go through that time block and determine whether the staffing in a specific unit or in the hospital as a whole complied with the nurse staffing plan during that block of time. So using the tool, the surveyors indicate the unit, the date that's being looked at, the block of time, and then record how many RNs were required by the staffing plan for that time frame and how many RNs actually worked during that time frame, how many LPNs were required and how many actually worked, how many CNAs were required and how many CNAs actually worked. If the hospital does not use LPNs, then those 2 columns would remain blank. The surveyors can then check a box for yes or no whether the staffing that actually occurred met the standards required in the nurse staffing plan. And the final column looks at whether there was evidence of attempts to meet the plan. So if there were vacancies, this column allows the surveyors to indicate whether the hospital attempted to fill those vacancies, or if there was a surge, whether the hospital attempted to increase staffing to meet patient care needs. The column itself refers to the replacement staff review form, so surveyors would then look to that form to look at what efforts were made to replace the nursing staff members or to gain additional nursing staff members for that time period. The Nurse Staffing Personnel Survey tool, which is marked as slide 13 in the webinar handout, allows the surveyors to look at the nursing staff members who are on duty during the time block that has been selected for review. So, nursing staff members, again, are RNs, LPNs, and CNAs. All of those individuals who are on duty during the selected time blocks are then listed under employee name, and the surveyors will look at what their status is at the hospital, either as full-time, part-time, float, or traveler, whether they are regular staff on the unit or replacement staff, what their licensure or certification is and whether it's current, their hire date, when they completed the hospital nursing department orientation, when they completed a unit-based orientation for this unit, and evidence of both qualifications and competencies for the work they're doing according to the hospital requirements, which may be included in a job description or in the nurse staffing plan. The records reviewed is actually the place where the surveyors indicate where they found this information, and for any specific employee, information may come from a variety of sources. And then the final column allows the surveyors to note any discrepancies. So, for example, expired licensure or failure to complete the unit orientation would be noted in this final column. The next part of this is actually the Personnel Survey Tool document list, and it's marked as slide 14 in the lower right-hand corner of the handout. The document list is simply a list of all of the locations that surveyors have found these personnel records, and so it's A through J, and it allows them to indicate when they're using their survey tools where they saw these records in case they need to refer back to them later. The next tool is the Written Staffing Plan Review. If you're using the webinar handout, it says slide 15 in the lower right-hand corner. The Staffing Plan Review is the opportunity for the surveyors to look at the staffing plan itself and any supporting documents such as committee meeting minutes that reflect the review of required elements that went into the composition of the nurse staffing plan itself. The Written Staffing Plan Review may consider a specific unit's plan or the hospital-wide nurse staffing plan, or both. The review looks at the approval date of the plan and then looks at the required elements, these elements such as specialized qualifications and competencies of staff, providing for the appropriate skill mix, measuring the activity level, including admissions, discharges, and transfers, are all elements that come from the administrative rule on nurse staffing plans, which were in turn taken from the nurse staffing plan statute. Surveyors will look for the minimum number of nurse staffing members, and nurse staffing members in this context means RNs, LPNs, and CNAs, and that number must always be one RN and one additional nursing staff member who may be an RN, an LPN, or a CNA on duty in the unit when there is one patient in the unit. Nurse staffing minimum numbers should be included in the nurse staffing plan itself and should not be an external grid that is not part of the approved nurse staffing plan. In addition, surveyors will look to determine whether the nurse staffing plan has been based on external benchmarking data and whether that's the only data that's used. And the tool allows them to write in how external benchmarking data was used, because that cannot be the only consideration in formulating the nurse staffing plan. In addition, the staffing plan needs to have a process for limiting admissions and diversions and initiating diversions for safe patient care. One of the questions we received was whether the process is acceptable if the process says that an administrator makes the decision without considering nurse input. The plan has to provide a way for a nursing staff member to begin that process, but the statute and rule do not actually say what that process must be. It's up to the hospital to determine what the process must be. One of the important things about the process, though, is that it needs to be documented so that surveyors are able to see when the process is used, both when admissions are limited or diversions occur, and also when decisions are made that should not happen, even when it has been requested. The documentation needs to reflect when the requests are made and how requests are dealt with, whether the outcome is a limitation on admission or diversion or not. In addition, the staffing plan review looks at when the hospital considers nationally recognized standards and the date of those standards. For certain types of nursing practices, there are nationally recognized staffing standards or acuity measurement tools. For other practices, those standards are not nationally recognized, or there may be a variety of standards. When a nurse staffing committee chooses to use one of those standards, they need to be able to document why that standard was selected. And if the standard is not the most recent edition of the standard, but an older edition of the standard, the nurse staffing committee should be documenting why that older standard was chosen in this situation and why that is a better practice for the hospital than the current standard. In addition to the review of the written staffing plan that the hospital is using, then the surveyors will review the Hospital Nurse Staffing Committee's annual review of the nurse staffing plan. All nurse staffing plans need to be reviewed on an annual basis, and the administrative rules and statutes include a list of factors that have to be considered by the hospital nurse staffing committee in performing that annual review. Again, this tool can be used for a specific unit or for the hospital nurse staffing plan as a whole. And surveyors will be looking for the review date, and then they'll be filling out a series of both yes, no boxes and fill in the blanks regarding those specific factors. As the rule requires, hospitals need to track the voluntary overtime hours worked and the mandatory overtime hours worked, as well as the percentage of shifts for which staffing differed from the nurse staffing plan. And so this information is likely contained in the hospital nurse staffing committee minutes or in the hospital nurse staffing committee annual report to the administration on the nurse staffing plan review. And so surveyors will be looking in both of these locations for these specific numbers that they can then fill in on the survey tool. As noted in the rule, the hospital nurse staffing committee can consider additional factors, and so there's a location for the surveyor to indicate whether additional nurse staffing factors were considered, and the minutes or the annual report should indicate what these factors were. There is a place on this tool for the surveyor to indicate when the nurse staffing committee submitted its annual report to the hospital administration, whether the committee recommended any changes to the nurse staffing plan, and whether those changes have been implemented. One of the questions we received was whether there are any examples of what the hospital staffing report to the administration will look like. We have no examples of this at this point. I would guess that each hospital's annual report will be somewhat different and unique, and the statute itself did not describe what needed to be in this report, but one of the things that would be likely included would be the factors that were considered and how the Hospital Nurse Staffing Committee conducted their annual review of the staffing plan. And it's likely that after a year or two, various hospitals will be willing to share their annual reviews, and that may be a good way to compare and contrast your own review so that you can determine whether your review is really providing useful information to the hospital administration and useful guidance in explaining why there have been changes to the nurse staffing plan. After the review of the plan, another item that gets reviewed by the surveyors is the replacement staffing requirements. So there are 3 different tools associated with replacement staffing. The first tool is the Replacement Staffing List Review. It's marked as slide 18 in the lower right-hand corner of the webinar handout. The Replacement Staffing List Review looks at the hospital's list of replacement staff. As noted, this list may be a centralized list kept by the hospital administration or a unit-based list kept in the unit, and sometimes hospitals actually have both a central list and a unit list. So in that situation, surveyors are looking to see whether the names on the list are the same. They also look for the dates of the list, and if there's more than one list, if there's an explanation of how and when each list is used. Surveyors look to see whether there is a written update policy indicating when the list gets updated, and then evidence that the list has been updated in accordance with that policy. So if reviews of the list are set to occur every 6 months, surveyors will look for indications that the list has been reviewed every 6 months. They'll also look for evidence of updates on the list itself. Have there been names added or removed? And when we talk about lists, this may not be a printed list of names. It may be an email collection of names. It could be a broadcast text message, and so a location where all of the addresses are kept. It may be completely computerized, or it may actually be a printed list that is posted somewhere. All of these will qualify as lists. The question is, does the hospital have a collection of names and contact information that surveyors can look at? The list may include off-duty employees, non-employees, staffing agencies, and really the list is going to be determined by the hospital itself. The question the surveyors will ask is whether the list has sufficient resources to provide replacements. Some hospitals do not use staffing agencies. Some hospitals share lists with other hospitals within the same health system. Both of these are acceptable options. The question is really, is the list providing enough names to provide replacement staff when necessary? One of the questions we received was whether the surveyors are going to be checking who has access to the replacement list. And surveyors will check to determine whether the list is available to the individuals who are tasked with finding replacements. So a list may not be available to the entire hospital staff. The question is, do the people who need to find replacements have access to that list? And at the very bottom of this tool, you see evidence of efforts to add names to the list. There are hospitals that do not have sufficient names on their list, and they make efforts to add to the list. These surveyors are looking for these efforts. That doesn't mean that efforts will always lead to more names on the list, but surveyors are looking for credible efforts that the hospital makes to add names. So it could be advertising locally or nationally. It could be reaching out to other hospitals or to other types of nursing service providers in the area. And all of these will be evidence that the hospital has tried to increase its list. The next slide is the Replacement Staffing Usage Review. This tool is actually used in the case of a specific vacancy. So when they're reviewing how a unit was staffed on a particular day, and if there's an indication that there was a vacancy or a vacancy was filled, then the surveyors will use this tool to determine when was the vacancy, when was it discovered, how many vacancies were there, and what documentation does the hospital have of the various types of replacement staff who were contacted and whether those contacts resulted in the vacancy being filled. In addition, there's a place for the surveyors to know whether the vacancy was filled with mandatory or voluntary overtime, and there is a location for the surveyor to note if the administration states that there was an emergency exception to the mandatory overtime rules. You'll remember that the emergency exceptions are very limited and relate to natural disasters where the facility emergency plan is implemented. So these aren't just a lack of staff. That in itself is not an emergency exception. It has to fall within the rule for emergency exceptions. And then at the bottom of this, there is more space for notes and whether the surveyors observed any deficiencies. The next tool is actually looks at a variety of required postings. And so it falls first under replacement staff because you see the third item there is the on-call or replacement staff list, and that it has to be posted. But by posted, we mean it has to be available to the individuals who need it. So it may not be a printed list on a wall, it may be online, but by posting in this situation, it means available to the individuals who find replacements, who are required to do so. And surveyors will write down where and when they observed this list. The other postings we'll talk about here are the complaint notice, and that has to summarize specific statutes. It has to be visible to the general public, and it has to include the Oregon Health Authority's complaint phone number, email address, and website address. And so this needs to be physically posted, and surveyors will look for where it's posted and note that on their survey tool. The next notice is an anti-retaliation notice. It has to summarize other specific statutes. It has to be clearly visible, and it has to be posted where employees and applicants for employment, where notices to employees and applicants for employment are customarily displayed. This one could be posted online. If it's posted on an employee internal website, then it would also need to be posted somewhere where it's available to applicants for employment. So that may be on the human resources page or something similar. If it's solely an online posting, it needs to be available to the applicants for employment, not just to the employees. And then the overtime policy needs to be readily available and provided to new nurse staffing members. So it may not be physically posted. Again, it may be online, but it needs to be readily available. One of the questions we received was that a hospital keeps a list of all employees on the unit, and these are the individuals that they use when looking for replacements. One of the other slides referred to on-call staff, and this posting survey tool also refers to on-call staff. But this is a hospital that doesn't maintain a daily call list. So their question was, what should be on that list? And on-call is defined in the rule, and it has more than one meaning. In some hospitals, on-call are people who are being paid to wait to be called in for a specific shift. In other situations, on-call can refer to employees who are not currently working or non-employees who are not currently working, who may be called and will take additional shifts or take shifts at a hospital where they don't work. So on-call is a fairly broad term, and it doesn't just refer to nurse staffing members who are part of a call list who are being paid to wait to receive a call to come in and work. So the on-call list in this situation is your list of possible replacement staff. That can be employees, non-employees, on-call employees, or staffing agencies. It's a very broad sort of list. The next set of survey tools relate specifically to hospital nurse staffing committee requirements and how the committee itself functions. The Nurse Staffing Committee Meeting Review allows the surveyors to take copies of Nurse Staffing Committee minutes and determine whether the minutes have the required elements and whether the minutes indicate that Nurse Staffing Committee meetings are operating in accordance with the administrative rules. Minutes should reflect the dates, the quorum, the attendance, motions made, and vote outcomes, and the voting record should be clear so that surveyors can determine whether an equal number of direct care and nurse managers participated in any given vote, as required by the statute. The minutes also should indicate when observers have been excluded, and there should be a notation of when the minutes were approved. Frequently, minutes are approved at the following Nurse Staffing Committee meeting, but some hospitals do approve their Nurse Staffing Committee meeting minutes by email following a meeting, and that email approval should then be noted on the minutes. Surveyors may look at 8 meetings as reflected on this form, but they may choose to look at more or fewer meetings. The question is really whether the meetings were quarterly and whether the meeting minutes reflect the information that's required by rule. There are some hospitals that are developing templates for meeting minutes, and some hospitals are moving away from having Nurse Staffing Committee members take minutes and instead having a member of the hospital administrative staff take minutes in order to facilitate a more professional meeting minute system. The Nurse Staffing Committee Charter Review looks at required elements of the Nurse Staffing Committee Charter as well as other required operational practices of the Nurse Staffing Committee that may be reflected in the charter or instead may be discovered through interviews with the Nurse Staffing Committee co-chairs. Surveyors will look at the date of the charter and look at the information in the charter itself, including how meetings are scheduled, how agendas are determined, how members are notified of meetings. They will also be asking questions about whether members are released from their assignments to attend Nurse Staffing Committee meetings and whether they're paid for the time that they are at Nurse Staffing Committee meetings. The release and payment are not required elements of the charter, but are required elements for Nurse Staffing Committee operations from the statute, and they may be included in the charter. Some large hospitals combine one or more units for purposes of representation on the Nurse Staffing Committee, and the charter is one of the places where these issues should be discussed, and it also may be a topic that's discussed with the Nurse Staffing Committee co-chairs in their interviews. The surveyors will be looking at whether the units that are combined are sufficiently related and whether the representation is likely to allow the nurses in all of the affected units to be adequately represented on the Nurse Staffing Committee. In addition, the Charter Review tool is the location where surveyors will look at where nursing services are regularly performed in the hospital to determine whether all units that should have a nurse staffing plan are are represented on the committee and have a plan. The Hospital Nurse Staffing Composition Review Survey tool looks at the membership of the Hospital Nurse Staffing Committee. Each hospital will keep its own roster of Nurse Staffing Committee members. This is a way for the surveyors to look at that roster and determine whether the committee membership meets the statutory and rule requirements. In a Hospital Nurse Staffing Committee, the direct care members represent each unit of the hospital, could be a specialty or a unit, and there is an additional nurse staffing member who is not an RN on the nurse staffing committee. The hospital will then appoint an equal number of nursing managers, so that's one for every unit or specialty and an additional nurse manager. The Staffing Committee Survey Tool allows the surveyors to ask whether the selection was conducted by a union or in a non-union hospital following the process set out in the rule. In some cases, hospitals may combine several units as part of representation on the Nurse Staffing Committee. Then the roster would need to indicate which units are represented by that RN. The Staffing Committee Survey Tool also looks at the date of the roster to make sure that it's a current roster. The Nurse Staffing Co-Chair interview that appears on slide 25, and in your packet of handouts, it says slide 25 in the lower right-hand corner, is the first of 3 pages of sample questions for the co-chair interviews. Surveyors may decide to ask additional questions or different questions. This sample interview form is their jumping off point and allows them to look for information that may not be captured elsewhere during the survey process. The next survey tools relate to overtime limitations, and you'll see that some of these are survey tools that we have already discussed. The Replacement Staffing Usage Review, the Posting Survey Tool, and the Annual Staffing Plan Review all have elements that touch on the overtime limitations. In addition to these tools, there is a specific tool, the Maximum Hour Review. The Maximum Hour Review looks at the specific nursing staff members working during a specific block of time in a specific unit on a specific date, and then looks for each of those nurse staffing members at the total number of hours worked by that nursing staff member during the shift from which the block is a part, whether that nursing staff member was on call prior to the shift or on call after the shift, the total number of hours that nursing staff member worked during a 24-hour period, whether there was documentation of any voluntary overtime during that time, so if there was overtime, was it documented as voluntary, the time between the end of the last work and the beginning of the current shift, and the total number of hours worked during that nursing staff member's work week. The last column is for the surveyor to determine whether the nursing staff member's hours, so any of the hours during the week or that shift that are recorded on this tool, whether those hours violated any of the mandatory hour overtime limits. So the A, B, C, and D relate to the specific regulations in OAR 333-510-0130, and those are the specific limitations on the prearranged and agreed upon shift, the maximum hours per week, the maximum hours in a day, and the 10-hour rest period that nurses can claim after working 12 or more hours in a 24-hour period. The 0 at the end of that is if the surveyor finds no violation of the maximum hours. They can note that there. Once the surveyors have used the tools in the nurse staffing survey set, they will be using the nurse staffing workbook. The workbook uses the administrative rule language itself and is broken into sections, and each section is then connected to the relevant survey tools that will help the surveyor determine whether there is compliance with that section of the administrative rule. This allows surveyors to specify for each topic whether there were deficiencies observed. The workbook provides space for the tag, and the tag numbers on this draft workbook are for demonstration purposes only. The final tags will be possibly slightly different, but the tag is another way of breaking out and tracking which regulation is covered by this specific deficiency. The workbook also provides space for surveyor comments and for references to additional documents. So on slide 29, and you see in the handout, it's labeled as slide 29 in the lower right-hand corner of that handout, is the beginning of the nurse staffing workbook. And you'll see that it is the beginning set of the nurse staffing administrative rules. The webinar slideshow does not show all 11 pages of the nurse staffing workbook, but if you look through the handout, you'll see all the relevant administrative rules. And then you can see that there is the relevant survey tool listed for the regulations so that surveyors know which survey tools to look to when determining whether there were any deficiencies for that specific regulation. For additional information about Oregon Health Authority's role in nurse staffing and about nurse staffing regulations in general, please go to our website, www.healthoregon.org/nursestaffing. On that page, we have the archived webinars from May and August of 2016. In addition, there are other useful materials such as prior surveys and complaint investigation summaries, information about the Nurse Staffing Advisory Board and upcoming meetings, and other general information about nurse staffing laws and regulations. If you have additional questions about nurse staffing, please contact Anna Davis. Her address is listed on this slide. And this slide also lists the other individuals who work on nurse staffing at the Oregon Health Authority, including Lisa Finkel, the Advisory Board Specialist, and managers Dana Sulliver and Annabelle Henry. For general information about hospital licensing and certification, contact mailbox.hclc@state.or.us. Thank you for taking the time to learn more about Oregon nurse staffing regulations and the survey and complaint investigation process. Please remember to use www.healthoregon.org if you have further questions or would like further information about nurse staffing.